So we have women whose lives are completely disrupted. And so though I read about myself in these many med pubs, and I read about how we're doing okay and how it's no big deal. If you do get it, it's no big deal. You know, Jennifer's retired. You don't have a choice but to get up and go to work every day. You know, Michelle doesn't have that choice. I was fortunate to turn my workaholism into selling my family business of 36 years into now being retired. Like, this thing does upset your life completely.
Oh yeah, no one should come away with the impression that there isn't real suffering, even though, you know, physically, you know, thank God, you know, the three of us are here today. But, you know, when I go to bed at night, I have a 5-year-old little boy, and it crosses my mind every single night. You know, there is real fear, and that was the fear that hit me the moment I got the phone call. It was, what was my son going to do without me? And I, you know, my nature, you know, is I'm a fighter, and so that's what I knew to do. And I did everything I could for myself, and what I was able to do was good fortune on my part. And so, you know, one of the good things about this illness is there's so much we can do, but it's awareness is the key, and fully informed patients and doctors, not partially informed, and it's an evolving situation. So you have to be vigilant, you have to keep staying tuned to what is new. And, you know, one of the issues here is insurance doesn't always cover what might be preventative measures, because we may not know whether someone has this or not, and it's a risk.
So in terms of a resource for creating awareness, because a lot of what we're talking about, the most important thing is basically awareness about the disease, the treatment, the diagnosis, both on the patient and physician level. So one great resource is the ALCL for Women with Breast Implants Facebook page. So Terri, why don't you talk a little bit about that, because it's been, not only has had a lot of growth, it really has helped a lot of patients and doctors. I need to get on it, I know, because but hopefully we can get more physicians on that too. But why don't you speak to that a little bit, because I think it's really important.
Well, I didn't start the Facebook page.
We know who did, though.
Right, we do. Jamie started the Facebook page, and Jamie was speaking to one of our patients, Monique, in Australia, and as I understand the conversation was, you know, nobody wants us. Lymphoma support doesn't want us. They didn't even have an updated website. Breast cancer doesn't want us. Though we have cancer in the breast, let's be clear, it's lymphoma in the breast. And so Jamie said, I'll start this Facebook page to see if we can find some other women for support. Every other cancer has bracelets and ribbons and logos. What about us? You know, my diagnosis was exactly 3 years ago, and there was 10 of us, and the majority of women who come to that site don't have lymphoma. They come to get educated to be empowered. And, you know, we read pathology reports every day. We're not oncology, but what we do know is what to look for. And if you have a pathology report that says, oh, they say I'm fine, but when we actually read the report, there was no CD30 test done, what we're asking you to is go back and speak to your physician, because either the lab didn't have the capacity to do it, the lab didn't do it in spite of the doctor's orders. We've seen that. And so what we're saying is, if it's not in writing, don't take that narrative. The narrative may not be correct. And we know that because we have women who have then been diagnosed.
So I know it's really helped a lot of patients, not only interpreting tests or, you know, answering questions correct, or helping them find expert to help in their treatment.
I wish there was more, right? That's something that I think is a whole. We are very well studied. We don't read documents, we study documents. So, you know, we all spend, you know, there's a reason I'm retired, and there is the reason that we have this time. And so do we spend anywhere from an hour to 4 hours a day? This is our volunteer work. This is our service group. This is why we survived, maybe. I don't know what it is. But I know that we just keep moving forward, knowing that there's a greater good to be done. and we're just going to do our little part.
And you're never, there's too much to do. I mean, I thought, you know, this was just going to be an hour of my day, can literally take up my whole day, because, you know, there's women messaging, you know, I've got this symptom, I went to my doctor, he says fluid is normal around the breast. Okay, there's another hour, because I'm not going to let that go. This person needs to be directed. You know, we have a woman who, she had swelling, and she goes, and the radiologist says there's not enough fluid here to get test, and she's like, keep trying, keep trying, keep trying. She begged her to keep trying. She's like, oh wait, there's a hidden pocket, a hidden pocket. She comes up with 8 vials of fluid. So we even know that even once there's swelling, that you know, we know where all the pitfalls are. We know where the ball can be dropped. And so we can walk a woman through all the things that can go wrong and what to do, and so that they're prepared for it. And then at the end of the day, they make their choice.
And if somebody wants to get to the Facebook page, they can just look it up on Facebook, or what's the best way for a person to get to that page?
So they could Google, you know, they could sort of just type in ALCL on Facebook, and we have a series of questions to vet members, because it is a private group. That's our private patient group. And so the intent is that women should feel safe and supported in that group. Then, not by design, but by need, we had physicians and clinicians trying to join the group. So Jamie actually recognized patient safety and support's important, and their privacy is important, but obviously there's a need for clinicians. We have clinicians from around the world, and so we started another site, which was patients and clinicians, and it's a place to share, you know, all your med pubs, all the research is shared there. People will query questions. Women with a diagnosis, because, you know, if there's currently 560 of us around the world with 16 dead, every story, every situation, every journey to a diagnostic test and then treatment is relevant. You know, with 560 in the world, every single one of us counts. By the way, we're not sure that we're counted, right? Every, whether it be the MAUD database or any of the registries, I think they're all clear that the flaws in the database say how many really is there of us? The last time that we took a MAUD database, there was, I think, 359 cases at that point. We shared that with our Facebook group by country. Only half the women could find their case. So we're suspecting that there's probably a lot more cases out there that just haven't counted anywhere. They're probably, hopefully, being treated, but they're not being logged, and that's what it is we want.
So if you're a clinician and you want to join the group, is it the same picture? As you said, there's a separate one. I just missed that.
There's a separate private group for clinicians that has patients on it as well, and there's a dialogue.
Right, but we're more selective in terms of which patients join the clinician group. There are patients that have, you know, symptoms and are very specifically concerned with BIA-ALCL, or who have been diagnosed themselves. So it's, you know, it's an opportunity for clinicians, you know, in real time to learn, you know, unique situations that are out there and how they're being handled. You know, my situation was somewhat unique in that I had an actual mass on the capsule that was biopsied with a core needle biopsy. You know, and I share my pathology report. You know, so there are real reports you can actually look at. You know, a lot of doctors may not know that can be done.
I think we see a lot of patients being told that can't be done. We can't go in and biopsy your capsule without rupturing or the risk of rupturing your implant. So, you know, we talk about what do we really need. One of the things we need is a core group of plastic surgeons who are up to speed, current on the literature, right? Because 6 months or 12 months ago is now too late and too old. We don't have enough surgeons around the world to recommend. These patients are coming from every single country. Well,
right,
40
we had one
countries.
from Cyprus the other day.
Cyprus,
you know, they're really all over the world.
They're asking us for help. How do I find a surgeon? I'm in Cyprus. Mm-hmm. We need, the US is huge, right? You know, geographically, Canada is huge. We need surgeons to recommend to these women.
Well, I mean, it's an incredible resource, you know, it's the good example of social media. I think, you know, my kids on social media,
No, not so
total
much.
gong show, but this is a great application of it. So, because there's not really anything similar to that for patients, for sure. So it's great that people have that and they can get their questions answered and you know, have some other people to kind of share experiences with.
Yeah, from a patient perspective, you know, my experience was I was sitting, you know, in my doctor's office, and he's telling me that I have this. Well, he didn't tell me. I got a call from the secretary booking an appointment. So he was honest enough to say, you know, you're my first patient, and I've reached out to somebody else who may know a little bit, and so that was helpful, right? That's my staging landed me at stage 4, and my oncologist, because now, you know, I'm finished with surgery and I'm out of plastics hands and I'm in oncology's hands, and when oncology says to you, Terri, we don't know anything. At that time he said there is one oncology paper written with a total of 60 cases, not 60 stage 3, 4 cases, all cases from stage 1 to stage 4. And he said, I can tell you, we don't know what to do with you. Standard lymphoma protocol, that's where we're going to start. What I didn't know is that they had a team, and somehow that gave me some sense of feeling better, that it wasn't just one person's opinion, right? That a multidisciplinary team at a large research hospital was at least looking at my case. And for me, at least had that piece that if there's a best effort on my survival, I think this is it. You know, I went on to have 6 rounds of CHOEP, so CHOP with E, and I failed. I then went on to have GDP, a secondary chemotherapy. I failed. And at that point, I was given a terminal prognosis. And it's very terrifying when your lymphoma oncologist that I had complete faith in is saying, Terri, we don't know what to do because there's not enough written about you. You know, one of the things I'd love to encourage with the research is we spend a lot of time on stage 1 and stage 1A and B, and whether this is, you know, malignant or benign course with I mean, it just, the language can be very confusing. But those of us with advanced stage, why aren't we being studied? You know, we have women, perhaps the ones that we find are the sickest. And the ones, you know, out of 100, you know, at least 30% of us are into chemotherapy. And it's grueling. Standard lymphoma protocol is a grueling chemotherapy. Under clinical trial, I got brentuximab. We've seen Jennifer get brentuximab first. You know, 100% of us have succeeded on brentuximab. I went from terminal prognosis to 4 rounds of brentuximab with the first clear PET scan in 2 years. I was no evidence of disease after 4 rounds.
We're a resource that any patient, you know, would, I think, do well to be referred to. You know, just based on, we can give facts, we can give articles, and we don't represent ourselves as experts. We're very careful to say, information we're giving you is, we refer them to articles, we refer them to doctors, and we say these are based on our experiences. And we share the documentation that we have from our own treatments and just the facts. And so we're not telling them what to do, but we give them enough information that they can then discern whether they're being treated by someone who is well informed. And that's, you know, that's 90% of the battle, is getting to the person who truly is informed so that you can be informed.